Good day, everyone. So, for today's video, we're going to tackle about the dosage and solutions, administer medication, and rights. So, we are the Group 6. I am Elrose in Santiago, together with Hierarchy Santiago. Are you ready? So, let's begin to the dosage and solutions. For the Clark's rule, it is a method of determining the correct drug dose for a child based on the known adult dose. It assumes that the adult dose is based on a 150 pound person. So for the solution, child dose is equal to weight of the child via pounds over 150 pounds times average adult dose. The second one is the French rule. It is a method of determining pediatric drug dose for a child younger than 1 year of age, based on the child's age and the usual adult dose. Second, it assumes that the adult dose would be appropriate for a 12.5 years old child. For the solution, child dose, age 1 year, is equal to weight of child, MO, over 150 MO times average adult dose. So the third one is the Young's rule. It is a method for determining pediatric drug dose based on the child's age and the usual adult dose. For the solution, child dose, age 1 to 12 years old, is equal to child age via years over child age years plus 12 times average. Move on to the parenteral drug calculation. Dosage is equal to doctor's order over stock on hand times the quantity, where doctors order how much dosage of the medication does the physician desire. Unit is usually milligrams. Stock on hand, how much medication do you actually have? Unit of measure is usually in milligrams. Quantity, the amount of liquid you end up having. After preparing the medication, unit measurement is in milliliters. Nursing note, if you are preparing medication that is powder form, you need to add sterile water in the vial to complete its final form. For every 250 mg of medication, you need to add 1 ml of sterile water. So we have here the parenteral drug calculation examples. The doctor's order will be 250 mg, the stock on hand is 1000 mg, and the quantity is 4 ml. So D over S is equal to 250 mg over 1000 mg, and 0.5 times 4 ml is equal to 1 ml. And for the other example, it is shown down below. We also have the IV fluid calculation. For the formula for calculating IV fluid computation for macroset, if the nurse wants to find the ml per R, it equals to ml per R is equal to amount of IV fluid bottle content over desired R's run for. If the nurse wants to find the drops per minute, it equals to ml per R times drop factor over 60 minutes. And if the nurse wants to calculate for microset, after getting the ml per R, the drops per minute is equal to ml per R times 60 drops over 60 minutes. So we have here the IV fluid calculation example. A client is admitted due to severe dehydration as a result of persistent diarrhea. The physician ordered the 5 LRS 1 liter connected to macroset to run for 8 hours. The hospital you are working for uses 15 drops as the standard drop factor. What will be the regulation of the IV fluid? So the first step, recognize that the question is asking for the drops per minute. Regulation of the IV fluid means how many drops you are going to regulate in under a minute in order to consume it for 8 hours. Second step, get important details. For the IV fluid amount, 1 liter. Tubing system, macroset, desired hours to consume, 8 hours. Drop factor, 15 drops. So the third step will be, now put it all together. ml per R is equal to 1000 ml over 8 hours. ml per R is equal to 125 ml per R. The fourth step, we have solved the ml per R. Now we can calculate for the drops per minute the actual regulation. My regulation is equal to 125 ml over R times 15 drops over 60 minutes. So the regulation will be 1,875 drops over 60 minutes. So the regulation will be 31.25 drops per minute. Because there is no such thing as 31.25 drop, we will convert it to range. The final answer will be, the regulation will be 31 to 32 drops per minute. The nurse needs to run the IV fluid at 31 to 32 drops every minute to consume it for 8 hours. So let's move on to the routes of administration. We have the oral. It is the most common, safe method, least expensive, most convenient route for the most of the client because of the skin is not broken. For the contraindication, vomiting, gastric or intestinal traction or unconsciousness and is able to swallow. We also have the sublingual. It is under the tongue. Buccal, pertaining to the cheek, held in the mouth against the mucous membrane of the cheek until the drug dissolves. We also have the parenteral. It is bilateral. Main advantage is as absorption, use of sterile technique. We also have the subcutaneous, or also known as hypodermic. It is 45-degree angle to the skin. These areas are convenient and normally have a good blood circulation. The common sites are the outer aspect of the upper arm, the interior aspect of the thighs, abdomen, scapular areas of the upper back, upper ventrogluteal, or dorsogluteal base. We also have the intermuscular. It is the 90-degree angle to the skin. Intermuscular absorption route is faster than subcutaneous. Muscle usually takes larger volume of fluid without discomfort than subcutaneous. As the size of the muscle decreases, amount of medication that can be safely injected also decreases. The medication that can irritate the subcutaneous tissue may safely given to via intermuscular. So that ends my report. The next reporter will be Hierophane Santiago.
For the continuation of the reporting, I am Hierophane Santiago, and let's move on to the next slide. We have here the intradermal. It is frequently indicated for allergy and tuberculin tests for vaccination. It is performed by inserting the needle in a 15-degree angle to the skin. It is not massaged because this medication may disperse into the tissue or out through the needle insertion. Next, intravenous. Intravenous medications enters the bloodstream directly. The insertion should be 25-degree angle to the skin using sterile technique. Appropriate when rapid action is required, and when medications are too irritating to tissues to be given by other routes. Next, topical. It is applied to a circumscribed surface area of the body. The purpose of this is to decrease itching or pruritus, lubricate and soften the skin, to cause local vasodilation or vasoconstriction, increase or decrease secretions from the skin, and apply antibiotic or antiseptic to treat or prevent infection. Next, we have here the infuse. It is injected into a vein with an IV line and slowly drip in over time. Inhalable, breathed in through a tube or mask. Intrathecal, injected into your spine. And nasal, given into the nose by spray or pump. Ophthalmic, given into the eye by drops, gel, or ointment. Rectal, inserted into the rectum. Transdermal, given through a patch placed on the skin. And lastly, otic, given by drops into the ear. Let's move on to the rights of drug administration. Here's the preview of the 10 rights of drug administration. We have the right drug, right patient, right dose, right route, time and frequency, documentation, history and assessment, drug approach and right to refuse, drug-to-drug interaction and evaluation, and lastly, education and information. Let's discuss them one by one. Number 1 is the right drug. The first right of drug administration is to check and verify if it is the right name and form. Beware of look-alike and sound-alike medication names. Misreading medication names that look similar is a common mistake. These look-alike medication names may also sound alike and can lead to errors associated with verbal prescriptions. In the first right of drug administration, syempre i-check natin kung tama ba yung gamot na binibigay natin. Meron kasing mga gamot na magkakamukha sila or magkamukha yung name. Dapat basahin yung mabuti para alam natin kung tama talaga yung ibibigay natin. Number 2, right patient. Ask the name of the client and check his or her ID band before giving the medication. Even if you know the patient's name, you still need to ask just to verify. Kahit kilala natin yung patient, ask pa rin, tatanungin pa rin kung ano yung name niya to verify na tama ang bibigyan natin. Number 3, right dose. Check the medication sheet and the doctor's order before medicating. Be aware of the difference between an adult and a pediatric dose. I-double check natin kung gaano karami talaga yung dose na ibibigay kasi there's a big difference between an adult and a pediatric dose. Number 4, right route. Check the order if it is oral, intravenous, subcutaneous, or intramuscular, and etc. In the right route, we should check if it is intravenous, subcutaneous, or intramuscular. There are medications that cannot be given in other route. We should double check it para makita natin ano ba dapat talagang paraan siya ibibigay. Number 5, right time and frequency. Check the order for when it would be given and when was the last time it was given. Check natin kung akma ba siya kung 3 times a day, sakto ba siya sa time ng pagbibigay natin. Check natin yung order kung kailan last na nabigay yung gamot. Number 6, write documentation. Make sure to write the time and any remarks on the chart correctly. Kapag hindi mo na-document, hindi mo siya ginawa, so make sure to write the time and any remarks on the chart correctly. Number 7, write history and assessment. Secure a copy of the client's history to drug interactions and allergies. Para makita natin kung yung gamot na yun is allergic pala yung patient or may mga gamot siya na hindi natin pwedeng ibigay kasabay ng i-administer natin. Number 8, drug approach and right to refuse. Give the client enough autonomy to refuse the medication after thoroughly explaining the effects. Kapag na-explain na natin carefully lahat ng tungkol doon sa gamot na ibibigay natin, bigyan natin ng autonomy yung patient na kung ayaw niya, kung tatanggihan niya yung pagbibigay natin ng medication na yon. Number 9, write drug-to-drug interaction and evaluation. Review any medications previously given or the diet of the patient that can yield a bad interaction to the drug to be given. Check also the expiry date of the medication being given. Check natin ano ba yung mga binigay dati na gamot sa patient or yung diet ng patient. Kasi may mga gamot na hindi pwedeng mapagsabay talaga dahil mayroong bad interaction na magaganap. And also, check natin yung expiry date. And lastly, number 10, write education and information. Provide enough knowledge to the patient of what drug he or she would be taking and what are the expected therapeutic and side effects. Dapat bibigyan natin ng enough knowledge yung patient about sa iinumin niyang gamot, kung ano ba yung expected na mangyayari after niya inumin yung gamot, and especially yung side effects kasi pag bigla na lang sumakit yung ulo niya tapos hindi natin nasabi na normal na magkaka-headache ka kapag ininom mo to, pwedeng mataranta yung patient. So kapag sinabi natin, at least alam niya na kung ano yung mga i-expect niya na mangyayari sa kanya. And that ends our discussion. Thank you for listening.